Traditionally, as we define sleep apnea according to the apnea-hypopnea index, and we know that typically 2 to 3 times more common in men than women. But that may be not the full story. We know that these disorders may present differently, so there's different manifestations, and perhaps some of that sort of old knowledge of sleep apnea being a disorder of overweight snoring men prevents many of the women actually being recognised firstly, so there's some bias in diagnostics, and but also the presentation may vary between men and women. Women tend to report more disrupted sleep, perhaps less severe snoring, also more insomnia type symptoms, which we're seeing now. If you've got insomnia and sleep apnea, what's called COMESA, that's really bad in terms of predicting outcomes, whether it be mortality or cardiovascular events. So yeah, quite a different scenario in terms of the manifestation, diagnoses and detection. And what this presentation was really about was trying to understand, well, physiologically, what is different in terms of those endotypic traits in terms of women and men. And so yes, there might be some bias in terms of identifying the differences between men and women in terms of the prevalence, but there's also probably some biological reasons why, on average, many women are protected from having upper airway collapse, at least in the same way as we defined it with the AHI. So what we found out is that the airway is less collapsible. When we summarise these data, it's known in the literature, so the airways, the anatomical vulnerability to sleep apnea on average is less, and in terms of the respiratory control or loop gain phenomenon, there's some aspects that are sort of protective and others that might be deleterious. So it really was a mixed bag, and it really comes back to the concepts that, if we're going to treat our patients ideally in terms of their precision medicine, we really need to know exactly why they're getting their sleep apnea, whether it's a man or a woman, and so that we can target therapies and solutions accordingly. I guess the bad news is postmenopausally, the prevalence rates, they become much closer to men. So premenopausally, some of the hormonal effects might be protective from a respiratory stimulation point of view and protect the airway from closure, but postmenopausally, those differences narrow.